There is a question about, I would love to get both your thoughts on this. And how do you integrate palliative care services and avoid fragmentation? One of the things that often happens for an oncology patient, and Ivy, please comment on this, is everyone is kind of really in a narrow lane of expertise. And sometimes it can feel like you're playing telephone a bit and you have to be your own advocate. And so, we definitely want to add the best members for the team, but maybe I could ask Ivy and then Dr. P your thoughts on how to best navigate this when there are many moving pieces, many balls being juggled simultaneously.
Yeah, I mean, I think it's very helpful if you have someone who can kind of help with that. I mean, many oncology offices have, an oncology nurse or a nurse navigator who, you can go to and have help coordinate this information. If where you're located, you don't have access to that, maybe you have a caregiver, and it doesn't have to necessarily be, someone you live with. It could even be, it could be a friend, it could be an other relative who has the time to help you kind of coordinate some of this information. And some people, can coordinate it themselves also. I mean, that's one of the wonderful things about some of these medications that we're taking, some of these targeted medications, is, the side effect profile is is not always, that significant. And as a result, a lot of us are feeling better day to day, and we can coordinate a lot of these things on our own. But I do, even from personal experience, have to admit that it is complicated, especially when you're going to several different doctors and different doctors are prescribing different things. You have your main doctor providing your cancer prescriptions, then you might have someone, and as Laura said, it might not necessarily be a typical palliative care doctor. It might be a dermatologist, or you might have a psychiatrist you're going to, and you're getting all these different prescriptions. And one thing that is really important to kind of keep in your mind are drug interactions. And especially if you're seeing a lot of different practitioners, sometimes you really have to be your own advocate to make sure everyone knows everything else that you're taking, and, to make sure that, nothing is causing, a combined impact that's detrimental to you. So sometimes you really have to be your own advocate for those types of things.
Yeah, I agree about that, and I also think it's unfortunate. Like, I think if we could go back to the magic wand portion of the Q&A and say, like, what would we change? Like, I wish we had a more integrated health system across the board where people had, a single electronic health record, and clinicians could always see, the experiences someone's had and the medications they've been prescribed. For us in palliative care, we have a new system within the past, I don't know, 5 or 10 years, in my state, of being able to see the opioids that have been prescribed in various places. And I wish I had that for all medications, just to see what people are getting from all these different places, to know exactly. But I think the onus, I agree that at the moment the onus is on people and their families, but the onus should be on the medical team to be keeping track and being in touch with each other. And that's part of the reason, I think, there was a question earlier about kind of receiving palliative care potentially in one place and oncology care another, or kind of how do you think about that? And that's one of the reasons that we have a pretty strong emphasis on trying to keep those things combined. And so yet another reason why I think all places should have some minimum type of supportive care in whatever shape it takes. But I think it is a risk to add additional kind of members to someone's team, but something that should be on us to sort of, if we're prescribing, making sure that we're prescribing safely and that we're in communication and coordination with each other.